This is Matt Ward in Provo, Utah. I'm going to show you how using a Simcoe during ICL surgery has made a big difference in my technique and I think for my patients. So why use a Simcoe to remove OVD? Well, conventional IA is potentially more uncontrolled and is not recommended by the manufacturer. Conventional IA is also more expensive. And OcuCoat can alter the aqueous fluid dynamics in the early post-op period, and if you've been doing ICL surgery for any amount of time, you've seen IOP spikes. It can be very frustrating. And you can even have simulated angle closure due to OVD that blocks the PI. So over the years, I've really become motivated to remove as much viscoelastic after implantation as possible. So here's a routine case of Visian ICL for high myopia. The ICL is injected into the anterior chamber. OcuCoat is then injected to push the ICL posteriorly. And each of the 4 haptics are tucked using the olive-tipped instrument. So everything to this point is routine. After this, the traditional way of removing the OVD is using jets of BSS, which is really inefficient and ineffective. So I hold the aspiration syringe, 5 or 10 cc in the left hand and the cannula in the right hand, and then the irrigation line is hooked to BSS that's hanging on an IV pole. This is a much less expensive option than using irrigation aspiration with a phaco unit. As you can see, there's good flow of BSS through the irrigation port, and then it fits nice and snug through an enlarged paracentesis and allows a very controlled anterior chamber. And here I use positive pressure. I think I'm flushing out with BSS, but air comes out. We just suck those air bubbles right back out. And as you can see, there's that OVD is really nicely going to the aspiration tip, and I can clearly see where OVD remains, and I can remove it easily. And the flat contour of the cannula or the Simcoe unit is very safe over the center of the ICL. I don't ever worry about pushing down or making contact with the ICL. At the end of the case, I put dilute myostat in, and I can rest easy that I know I've got the OVD out of the anterior chamber and I'm not worried about pressure spikes. This is Matt Ward in Provo, Utah. Thank you very much.